Anyone? Yes, you have been silent, this group. Integrity, is that integrity? Integrity. So I want to see your view about the integrity of the people in the world.
Yeah, thank you, Professor. What I think what I get after I hear about your lecture and about the video is our main challenge here is how could we balance between economy and environment. I mean, President Trump, what he said is right and wrong. He is right because the current regulation is limiting the economic of the American, but he is also wrong because he simply pull out from the agreement and then neglect the environment. I think that it is important that we should balance both, because if we conserve the environment but we neglect the economy, the city or the country will be underdeveloped. They won't be able to go forward. But if we care about the economic and don't care about and neglect the environment, the people will also suffer because of bad air, pollution, and disease.
Okay,
but I
good,
think
good. But now I ask you, what is your proposal to solve this issue?
I think we should find a balance. I mean,
how?
We should mediate between the economists and environmentalists. We should innovate something that could promote sustainable development.
How? Your
That's a matter
background
of
is
how.
health. Your background is health. Now you are facing other issues, right? Economist, development, conservationist. How are you going to make the balance or bridge that? Or you have to wait until the end of the Global Health Through Leaders training and then, yes, I can do it. Or now, no, I know now. At least some portion of it. Yes, I know it. What I'm trying to, or I'm waiting from you is that when you give me a chance, I will do it. It's only about opportunity. I don't have, at this moment, this is your answer. I don't have the opportunity now to be the president of Indonesia or the president or the leader of the world. If I have the opportunity, I will do it. And when I ask you how, then you say, this is what I'm going to do in making sure that the discussions, the confrontations will be productive to find the solutions in balance of that. So that's what I'm looking for you, from you. Okay? So, any more questions, issues? Yes, teamwork. Questions, issues, or whatever you say, challenges, the challenge in teamwork, the global teamwork.
Okay, thank you, Professor, for the very insightful speech. I'm very interested about what you said about the politician. So, could you please explain, elaborate more, what is the similarity and the difference between politician and the leader? And the second one, I want to know what is the core competencies and the mindset that the politician and a leader must have.
Okay.
Thank you.
Thank you. This is hard questions. What is the difference between politicians and leader? What is the difference between public health officers and leaders? What is the difference between medical doctors or physicians with leaders? Right? All professions can be the leaders. All professions may have leadership. All professions may take the lead. All professions may follow, right? So, there are some politicians who are the followers. If he or she is the leader of the political party, so he or she is the leader. It depends on the positions. But when you're talking about effective leader, is the leader that would like to make a change. So that's why tomorrow you will listen to Professor Renald Kasali, and he is the guru of change. Everything is about change. Why we need to change? Because the settlement or whatever it's settled now is needed to be changed because of the changing in the world, populations, deforestation, development, whatever. So we need to change, to adapt with the change. So that's why, how can we excel ourselves to involve in the leadership, not necessarily to be the leader as one person, but as a group, as a society, we can be a leader group that to make the change. Any professions, any roles, but of course, when I always ask you who wants to be a politician, because the political leader, because of its role in the nation, of course, it will impact more compared to any one of you who are working in the field front lines, public health facilities, in the tip of the Aceh, for example. It's very different. So that's why you have to understand whether you are going to be the political leader or not, it's up to you. But at least you understand. If you want to make a change, you need to see what would be the best prospect to change. Anyone? Unity. Yes, you.
Thank you, Professor, for the chance. So, my name is Dylan, and I'm from the background of pharmacy. So, one of the challenges that I would consider to be the most popular challenge for pharmacists or maybe undergraduate pharmacy from all around Indonesia is the distrust or people not believing pharmacists enough to, let's say, to teach them things or to control things. Let's say, for example, if I want to tell someone, I think you should finish that antibiotic soon, and then that person say, no, I'm not ill anymore. I think I do not need to take any medication anymore. But the fact is that actually, if you do not finish consuming antibiotic, it can create some kind of antibiotic resistance. Like as simple as that is, some case as simple as that is a sign that sometimes our profession, or not only pharmacy, perhaps other health-related professions are being underestimated by people, as people maybe believe that we are thinking over, we are overthinking and we are being too cautious to people. And what I want to ask is that one of the solutions that you have already considered and have already taught to us is being a leader who can lead people and who can convince people. And one I want to ask to you is, how can we convince people? Like, how can we make our profession is not something that people consider too cautious?
Yeah. Okay. I have not answered your questions, right? The competency. The competency of the leadership, which is very important, which is missing among you, is the soft skills. The hard skills, you know. You can use your epidemiology method, you can use the research method, you can use your anatomy, clinical, whatever competencies that you have. But the question is that, are you competent in the soft skills in terms of interpersonal skills, communication, leading, convincing, empowering? So this is the training, the soft skills. You can be a very sharp knife, but if you don't know how to really use it in terms of navigating it, then you can use it for other negative things. With the soft skills, it will enable you. But the first question would be, what is your commitment? Are you committed to the development of your country? I have to say your country because there are Philippines. If I ask for the Indonesians, are you committed for the development, the growth, the betterment, whatever the best for Indonesia? You say yes. You have to say yes. If you don't have that kind of commitment, so what is your intention then? If you have a very sharp knife and you have industrialization's expertise. I want to build the biggest palm oil industry in Solo. It's not appropriate, but I want it to, because this is in Java, because this is the consumers are located. You see that when you have knife, but you don't have interpersonal skills, sometimes you don't check whether this is the right things or not. But if you have only the soft skills, but you don't have the hard skills, you are missing something too. So that's why, in reality, in the educations, in your educations, everybody is excelling in your technical skills, right? And you're lacking in your soft skills. Communicating with other professions, understanding them, energizing, uplifting the others to work together and try to avoid conflict. Sometimes you have to make conflict to move forward, but then you have to extinguish that. So, you have to play around with the soft skills. If you are interviewed by the media, for example, how are you going to say? It's not about only science. So that's why the skills that you have to excel. And this is one of the examples. And the issue is that if this is your first or probably your last opportunity of a leadership training, don't ever think that I can make another or involve in other trainings, and then I will be a better leader. Treat this as your last chance. So that's why I learn, exercise, make mistakes. Don't make mistakes after this training. You can make mistakes now. Okay? Okay, I will end this conversation at this moment, and I will continue about your issues later in the One Health sessions about the AMR and others. Okay? Thank you very much.